We're gonna have some fun, and I only have 20 minutes, and just know I usually have about an hour, so let's jump right in. So let's set the tone. So, come on. If we can up the volume.
That's one of my mission parameters. I'll drive. Trust me.
All right, and let's just jump into the next one. And the next one, let's make sure we get the audio up a little more. All right.
As a patient advocate, I'm excited about the potential of AI in healthcare. I enjoy following Dr. Castro on LinkedIn.
Accurate early disease detection, groundbreaking.
This technology promises a future where care is customized to each individual's unique health profile. Keep up the good work, Dr. Castro.
Yes, predictive diagnostics within reach.
Thanks to innovation in this field, personalized healthcare is becoming accessible to all. I'm happy to see that Dr. Castro wrote the first book on ChatGPT and healthcare back in 2022.
No more injuries undetected?
Hi, as an AI researcher, I collaborate with medical experts, like Dr. Castro, to develop technologies that predict health risks, personalized therapies, and support surgical procedures. Our aim is to leverage AI to not only improve health outcomes, but also to save lives.
VideoGen AI medical imaging transformed.
The new iPhone 18 will leverage small language models. I am excited to see what applications Dr. Castro will create. He has several Apple Vision Pro applications out.
Yes, predictive diagnostics within reach, guided by Dr. Castro's expertise in AI and healthcare.
Now, let's make sure all of us at this conference follow Dr. Harvey Castro's lead in revolutionizing healthcare with AI.
I am happy to see Dr. Castro as the speaker today at this conference. His insights are invaluable.
All right, well, we have to start with some fun, right? All right, so, and this is an AI conference, so I can get away with this kind of stuff. So every slide that you see has used AI. This video that you're about to see was just text to video, even down to some of the wording. This image right here just shows you how many startups as of March of this year. I mean, look at that. That's just ridiculous. And these are all AI startups. And so obviously we're seeing them in every industry. I'm sure if I polled everybody here, we're in all the industries, and you guys can have heard of some AI in your industry or something coming. And there's that video animation. I literally took this slide and I put it into AI and said, give me a video for this slide. And that's the image, and that's the video. And so as we move forward, what is the current state? As a doctor, I'm really passionate about this because number one, there's not many people that are really pushing it as far as doctors. So I'm taking medicine and AI and putting it together and saying, no, these are the ways that we can help our patients, and let's do that now. And so when I look at how we're able to increase our lifespan, increase our health care professionals, there's so many people that are wanting to retire. Tons of nurses are like, Harvey, I'm out, I'm done. And I'm gonna give you some quick solutions of how we can make sure that our healthcare professionals stay here for a longer time. And so this is a story about Alex. I'm just curious, has anyone heard about this case? It was last year, you guys? Okay, good, not many, awesome. So basically this poor child, imagine going to the doctor, 17 different doctors to be exact, and none of the doctors gave you an answer to what was wrong with you. And imagine you had a little child named Alex, and your little kid was like, Mom, I can't play. I can't go to the playground. My leg hurts. I'm in so much pain. I mean, how horrible that would be as a parent. And then for 3 years not knowing what's wrong with your child. I mean, that really devastates me when I think about it. Obviously, I'm about to say, ChatGPT gave her the answer. She took all the medical data, all the medical reports, the history and physical for 17 doctors, uploaded it to ChatGPT. Now, granted, you're not supposed to do that, HIPAA and all that stuff, but play with me for a sec. But then ChatGPT said, you know what? This could be tethered cord syndrome. And then she went back to the neurosurgeon and said, hey, ChatGPT told me this. I almost died there by the sec. And then the bottom line, ChatGPT told her. And I thought, man, what a story. And this is the one story, this is the one slide that I'm like, this is why I do this. This is why I think it's so amazing. And this is why we need to do something. And so as we move forward, another thing, I wish I had an English accent, like a really cool English accent. So I cloned my face, I made this video, and I said, you know what? Here's my clone, read my slide.
What are the AI components in healthcare? Definition: artificial intelligence, AI. Simulation of human intelligence by machines. Key components: machine learning, ML. Algorithms that enable computers to learn from data and make decisions. Natural language processing, NLP. Allows machines to understand and respond to human language. Computer vision. enables machines to interpret and make decisions based on visual data. Robotics, application of AI to perform tasks that typically require human intervention.
All right, well, I wish I had that guy's accent, but that's for another story. In the interest of time, it's the same slide. I'm just going to flip to the next one. So everyone in medicine has heard of Watson AI, and this was supposed to help us in oncology. We're supposed to come up with these algorithms, and if a patient came to me, I was able to look at all of the data that's out there, and it would say, hey, doc, here's the treatment plan, and unfortunately, it didn't come to anything. They ended up selling, it didn't go any far, but these other two companies took that concept, and I feel like they're doing a better job. And I'm starting to see now signatures of now they are doing those things that Watson was hoping to do. What's the difference? Our GPUs, our power. I mean, there's so many factors now that we can get things done. So I'm really excited to see stuff like that. Cleveland Clinic now claims that they can do predictive analytics, and they can reduce readmissions by 12%. Different hospital systems are doing this, New York Tron, Gatortron, and what it is they just created their own large language model, let's call it ChatGPT equivalent, and they took all the data of all the physicians, all the patients that come to the hospital, and then they said, okay, you know what? You are exactly like this patient, but if I send you home, there's a 12% chance that you're gonna come back, so let me keep you another night. And I thought, man, what a way, because I have 20 years of clinical experience as an ER doctor, but if you add AI, plus my clinical gestalt, and that's my big take, is AI plus human is always gonna beat the best human or the best AI. And so as we move forward, I see all these bots, all this fun stuff, and here's Sarah, and I'm gonna let her talk for a little bit. Oh, darn it, maybe it's not in there, but basically, she's a bot. The World Health Organization has obviously preventive measures, and they want to make sure that you're not smoking, you have better mental health, that you're losing weight. And they made a bot that's in, they keep updating it. I want to say it's in 8 languages. And this bot is 24/7, and you can ask these questions and go back and forth. And so if the video had worked, it would just be her talking and explaining. And I thought, man, what a cool way to deliver medicine, because now there might be some person that doesn't get that information, but they may feel more comfortable having a conversation, and it's interactive. You can interrupt her and talk and go back and forth. It's pretty cool. And so Hippocratic AI is another one. I know a lot of nurses were upset. I know the news had the nurses out in California complaining about AI, and what they did is they have all these different algorithms, all these different nurses, as you can see, nutrition, pharma, and then what they did is just help the doctor take a better intake, or the nurse. And so it literally would call you, and then you would have a conversation and go through your meds, and it would be able to go back and forth and take that in. And they're charging about $8 an hour, and they're saying that this would help decrease our healthcare costs, and it would help. And so for better or worse, I think this isn't a bad idea. I think this is good because we need it. The alternative is we're gonna have some burnout healthcare professionals. They may be short with you. They may not give you the time you need. And so I'd rather have this for now to help us bridge to make sure that you're getting the best care. And so as we start looking forward, I'm really big on communication. I think this is the easiest low-hanging fruit that we can do today. ChatGPT, the ability to communicate is huge. I used to work at an airport, and right next to an airport, and every disease in the world, anyone that got sick on the airplane would literally come to my hospital, and I would have to take care of them. And sometimes I didn't understand what they said, I didn't know their culture, I didn't know many things, and I'd be so nice to have a bot that would help me translate. And I'll show you some quick demos of how I could translate with that person, but take it to the next level. What if that person, I'm in Texas and I start talking about football, but what if they're European and I say football, they're like, oh, soccer. And I'm like, no, we're talking 2 different languages. But if I could use AI to really help me communicate. And so for my patients, I made this med helper, because how many times have you gone to the doctor and you have a horrible experience, and then you finish and you're like, man, I should have asked X, Y, Z, I should have said this, oh my gosh, I forgot. So I made this bot that basically helps you figure out what questions to ask. So when you're at the doctor's office, you already have a list of questions, and you know what to ask because you don't know what you don't know, right? But if you have AI to help you combine what you're thinking with your disease process, now when you meet with the doctor, you're gonna have a better experience. The average visit is only about 12 minutes with your doctor, unfortunately. And so I thought, man, how do I use AI? How do I use it for my pediatric cases? So here's another clone voice.
Correct inhaler technique for children. Managing asthma triggered by sports. Communicating asthma symptoms to adults.
And so what I did is I cloned my voice. I took my discharge instructions for children, and then I was able to break it down and then use the core concepts, and then I pushed it into an AI to make a coloring book. And now when I discharge a child, I can say, here's your coloring book, and we can go through the principles. And now I know that they're really understanding the disease process. And so as we look forward, there's all this fun stuff. I do it in a comic strip. I do it in playbook. I did a GPT podcast. It's kind of fun. I literally just clone my voice. And with my voice, I can take any blog and have a fake conversation. And within 5 minutes, I can push it out with me as if I did a podcast. And it's me leveraging. And I said, what if I did this for my patients? What if I just took my discharge instruction and pushed it out with my voice? And I'm going to show you an image of that in a minute. And so this is a quick little plushie.
Tell me about this device. And I wanted to check it out. Hey, Grok, how are you?
Hello, Dr. Castro. I'm feeling charged up and ready to explore with you.
Nice to meet you. What all can you do?
Nice to meet you too, Dr. Castro. I can tell jokes, play games, and chat with you.
All right, let's give me a joke real quick.
Why did the Scarecrow win an award? Because he was outstanding in his field.
All right.
Well,
so the skinny is my business partner and I now are creating our own little plushie, and we're going to put it in clinical trials for kids that are having trouble and help them walk them through their issue. And they can have a conversation with the AI, go back and forth, better understand. That lag time was bad, so we're improving the lag time. We're also helping with the just the whole process where it's more fun voice, it's a kid's voice, not so robotic. And so as we move forward, this is interesting. Microsoft released this a couple of months ago, and it blew my mind. All it is that image of the lady that you see on the bottom left, plus a video, plus an audio, so it's just audio. And so imagine if I dictated my discharge instruction and I just took an image, and then watch. Come on.
Have you ever had, maybe you're in that place right now where you want to turn your life around, and you know somewhere deep in your soul there could be some decisions that you have to make, like it's like something was decided for you, and instead of trying to make some.
So I'll pause it, but can you imagine? That was just with an image and audio, and it did the facial and the muscles, and it sounds real. So Microsoft will not release this right now because of the elections. But imagine if you put it in the hands of a doctor that could give you your discharge instructions that way. Because how many times have you gone to the doctor and they said something and it's like Charlie Brown, because after that you're like, oh my God, they said X and I can't deal with it. And then after that you don't hear it. But what if I recorded it and used AI and now I gave it to you? And so like at 2 in the morning you'd be like, oh yeah, now I can go through this, and now you saw the transcript. And that's such a better way to deliver medicine. There's this cool thing called the pendant. It's coming out in the fall. There are multiple projects like this. Just imagine a little tiny pendant that goes on you, and then when you see the doctors transcribing. So I won't bore you with my English accent, but that was...
Limitless pendant preserving
And it just reads
conversations,
the slide.
lunch meetings, conferences, client calls, or doctor visits, personal reflection, verbal processing, thinking out loud, capturing a thought while your hands are busy, organizing the unexpected.
So I'm going to keep going in the interest of time. So obviously, we got to talk about ethics real quick, and I don't have that much time, but at the end of the day, I'm really worried about my patients. I'm worried about, especially patients that are outside of the United States. I can just go to a pharmacy and say, hey, ChatGPT told me I have this disease, and it told me I could take this drug, and here I am, give me the drug. And I'm like, no, we're not doing that. And so I made this algorithm for my patients. I give it to the hospital systems, and it just makes sure that the human's in the loop, and it's not just any human, it's the right human. In this case, it'd be a doctor. As we move forward, I'm really excited about AI's vision, and we're going to start looking at things. This is a company I'm associated with, and I'm just going to play the video. There is no audio at all, but what it does is pretty amazing. I have patients that are at risk for falls. If they fall, especially the elderly, if they hit their head, they can break their hip, their mortality goes up, and they can unfortunately die or something bad. And I thought, if we could put a camera in the patient's room, and then you're like, oh my God, camera, big brother. No, it doesn't recognize their face. It's just like that stick figure. That's what it's seen. It doesn't recognize that particular person. But then it could send a text to the nurse or the doctor saying, hey, your patient is about to get out of bed. Now, they haven't gotten out of bed, they're still in bed, but now it gives time for the AI to call the nurse, call the doctor, and then the AI can also talk to the patient and say, Miss Smith, what's wrong? Don't get out of bed, and now we can use that. So I just think this is just an amazing way, and we're gonna start seeing more and more of this technology everywhere. And so what is the future?
By a revelation, a vision, a picture in my head, a picture of this, the flux capacitor.
So I truly think we're gonna start seeing robots, and I really believe that the vision of the robots, it's gonna have ChatGPT 5 or 6, and what it'll have is, it'll analyze my voice, and with my voice, it'll say, that person's sugar is this, that exists already. It would hear a conversation between you and I, and the AI would say, he or she is depressed. I can hear it. She's at risk for Alzheimer's. He's at risk for Parkinson's. I hear it in her voice. I'm analyzing, and I say, you know what? I hurt my back. Can you help me with the patient? And the robot's helping me lift the patient. And I know that sounds like a scary thought, but that is coming. And so I foresee that we'll be here by the end of next year. And so as we move forward, we start looking at all these different technologies, and I'm really excited about the vision. The MetaVision Pro, the Meta Ray-Bans are these glasses, and basically I could take a picture of everybody like that. I can hold this longer and take a video while I'm up here. But what's really cool is I can have a conversation. I could pair this with ChatGPT, and if you ask me a hard question that I know, I can ask ChatGPT, it'll tell me in my ear, and I can hear it, and I can respond it. That'd be one way. The other thing is if in medicine, I put some funny rashes or weird things and say, hey, what am I looking at? And I thought, man, what a cool tool if I could start using this in healthcare. The Rabbit R1 has really bad reviews, but at the end of the day, I see it more as a proof of concept. You know, this thing is paired to Midjourney. If I need some slides, I literally say, hey, I need a slide on X, Y, and Z. It'll do it, and then I can transfer it to these slides. This is paired to Uber, so if I get a lot of bad looks, I can say, hey, get me an Uber, and it will find me and get me an Uber out there. And it'll be right there. And so this is pretty cool stuff. In healthcare, I see it more as an ER doctor. I can take a quick EKG, it would analyze it, and send it to all the people that need to know. I'm wearing the Humane AI pin right now. I won't do the demo, but the skinny is, I could hold it and translate, and in real time, it would translate. So imagine if I'm at a pinch and I don't know XYZ language, and I can just go back and forth. These are the things that are here. The small language model, it'll be on your phone. Imagine if you're in the Grand Canyon, someone keels over and you're like, oh my God, I don't even know CPR. But now your iPhone has all that information in the phone and can look at you and say, you're going too fast, you're going too slow. And then you point it to the satellite, and then you're able to get a helicopter to save that life. This will be here. And so as we move forward, in residency, the last thing was the Apple Vision Pro. When I was in residency, it was see one, do one, teach one. They would be like, Harvey, intubate. And I'm like, oh my God, I just saw my first intubation. I was like, no, now it's your turn. I'm like, oh my gosh, I read about it. I just saw this guy do it. But what if I had an Apple Vision Pro where I could intubate 100 times before I touch the patient? How much better would I be? And so these are the kind of fun stuff that's coming that I feel that it's the future. Now, one of my friends sent me this slide, the skinny is this. Make sure you follow people on the right, the left, bottom, right, because there's no one person that knows it all. So I really encourage you, the more you learn, come to these conferences, the more you can communicate with each other. Obviously, reach out to me and feel free to hit me up. This is where it's quick.
Can you tell me about AI and healthcare?
Oh, this is a fascinating area. AI is making waves in healthcare.
And I won't play it all because I know I got to run, but the skinny is this. I'll give you the link, and it's basically, it's a podcast, and the next drive you're doing, you can ask on the podcast, hey, what's going on in today's news? Hey, what's going on specifically to my industry in this? And it's like, it literally will go to Google, extract the question, and it'll go back and forth, and you can interrupt that. So it's pretty cool. I mean, these quick GPTs, feel free to hit me up, and the last slide, I have a QR code, and you can get them for free. They're just how to use GPTs in healthcare. And then I clone myself, all my books, all my interviews, all my TV, everything I've done, I made my own digital twin. And that little wand that is at the bottom right, right there, that's my digital twin. So you can literally say, what does Harvey think about AI in healthcare? What does he think about ethics? What does he think about welding? And it'll say, he's never talked about welding, so I don't know. So just so you know, try it out. And then there's my QR code. Feel free to scan it. If you want a copy of these slides, it'll take you to a form and you can download it. And then this is...
Hasta la vista,
Baby, I'll be back.
And I'll be back, hopefully.